Dr. Miller, let's talk about patients that travel to see you. There's patients coming in from all over the country. What is it about your practice that brings them to fly in?
Well, I think that this plastic surgery is a very unique field in that you can travel for plastic surgery. You can travel, you have to dedicate a certain amount of time to be in town and to heal, and that varies from procedure to procedure. But it's not like heart surgery that would require months of follow-up and cardiac rehab and would be difficult to do in that fashion. So it's neat to be in a field like that. It allows us to go on volunteer trips to the third world and help patients, and it allows patients who want our help for cosmetic needs to come to us and come spend a couple weeks, recover, and go home, and have benefited from what they perceive as a higher level of care, or a more appropriate and better fit level of care than what they saw elsewhere. So it's great that we can do that, and I'm honored that these patients travel. Of course, it starts by taking care of a patient who then has friends somewhere else, and when that someone else is looking, then they come, and they may come from Seattle, and they may come from London. I had a patient from Dubai, and so they come. But then pretty soon, you've developed this network, which is actually fascinating because it's a network to places you've never even traveled in many cases. I'm certainly not going around the world doing consults, but fortunately, fortunately for me and for our office, people see the value proposition of coming, getting our thoughts, and when they feel like they have a good fit, patients will do what they have to do and go where they have to go to get the best care and the best attention. And again, with modern technology and modern travel, it's not that hard. We do stay true to good medicine, and we're very honest with people about the time it's going to take to get them to heal properly and the involvement we need. But with that in mind, I have a couple coming in from London in about a week and a half, and they're coming together. They're both going to have some surgery. They'll spend about 10 days here, and they'll go home better than new. We do a lot of that, and we enjoy it. I feel like it diversifies me a little bit because I get to hear aesthetic concerns from around the world, while I can sit here in my own backyard.
That's awesome. And I also love the idea that the patient can fly in for their procedure and they can heal before they go home. So it's not like they have to go back to the commotion of life, and they're more tempted to maybe get too active too soon. They can stay here, rest, recover, and then go home to life.